Chances are that you've heard that eating too much red or processed meat could be pretty bad for you. So should it be regulated in the same way as cigarettes or foods linked to poor health, such as sugary drinks and the like? This is Roundtable. I'm David Foster. Welcome to the programme. Right, if bacon, salami, chorizo, bratwurst and a whole host of other things are a burden not only on the planet that we call home, but also to public health and to hospitals, should governments encourage healthier diets and recoup some of the costs? We're talking about the idea of a red meat tax after researchers said that price rises could reduce consumption, save lives, and probably more than $40 billion globally in annual health costs.
In 2015, the World Health Organization concluded that processed meats cause cancer. The same was probably true for red meats like beef, pork and lamb, it said. Researchers from Oxford University found a meat tax would cut consumption by about 2 portions per week in high-income countries and by 16% globally. Tax rates should reflect local spending and health habits, they argued. But in the UK, an 80% price increase would prevent nearly 6,000 deaths and save the public health system more than $939 million. Should consumers contribute to the cost of treating diseases that eating red and processed meat can cause?
Let us start the conversation now on Skype from Brussels. We have Bill Wirtz, Policy Analyst, Consumer Choice Centre. Also via Skype, this time from Washington, D.C., Marco Springmann, researcher at Oxford University. At the Roundtable, Kirsten Davies, nutritionist and founder of the Food Remedy, and Sophia Lowe's Health Information Manager at Cancer Researcher UK. Since you're both in the studio and you're both into food on this subject, let me ask you a very personal question. Is the steak I'm going to have tonight going to kill me?
Depends what you have it with. Depends what you've eaten for the rest of the day.
And for the rest of your life as well.
Not just one thing once. I mean, I don't think, I'm just going to put it out there straight off, I don't think they should introduce a red meat tax. I think processed meat, I mean, it just needs to go back. We just need to...
We're talking about sausages when it comes to processed meat. Are we talking about pâtés? What are we talking about here?
Everything they're saying that is red and processed meat. So I think there should be a substantial difference, and there is, in my opinion, between red meat and processed meat. You can have a 5% fat mince steak that's got lots of health benefits, you know? Of course, when you're talking about sausages, they don't really hold much nutritional value. So, but who is it gonna affect the most? Is there really gonna save 6,000 lives? Are people gonna really stop eating it?
This is where I'm going to come to Sophia here. Possibly 6,000 lives, probably this, possibly that, maybe this. This is what I'm hearing, and there is nothing concrete at all. What evidence have you got that these foods cause cancer?
So how we determine whether a food causes cancer is we follow people, large groups of people, and that's particularly important, follow them up for a long period of time, ask them regularly what they eat and what kind of foods they're eating on a regular basis, and then you kind of split them up and you take into account not just whether they're eating more bacon or more steak, but also all those other aspects of their diet and other cancer-causing things that they might be doing. So
you pick perfectly healthy people and
yes,
ask them what they eat and then see if they get cancer.
And follow them up to see if you get cancer.
That's no evidence, is it? That's just
but what you can do is compare the people who ate more meat to the people who ate less, and you can also divide that up by processed and red meat, and then by kind of taking into account all those things that we already know.
Study, is it? It's not.
It is observational, but
it's not empirical evidence.
It's not the kind of thing you could run a randomised control trial on. You can't ask a group of people to eat bacon and another group not. This is the best. These large cohort studies and kind of grouping together these large cohort studies is the best evidence we have that processed meat causes cancer.
Marco, tell me, you're in Washington, D.C. to give a talk to the World Bank about food and the way we deal with all of this. Your Oxford University study, what did it find out about the difference between a clean cut of red meat, and I know pork's included in that, and processed meat. What did you discover?
Well, there are very large differences, and those come back to both those cohort studies that were just mentioned, but also due to mechanistic studies that look what is going on in the stomach, for example. So I think we can have trust in some of those numbers if we have evidence from multiple different domains, and for red and processed meat, we do. We found that the tax rates that we calculated that would account for the health cost associated with consumption would be about double the price of processed meat and about 20% more of unprocessed red meat. So there is this differentiation that reflects the differentiated health cost of red and processed meat.
Okay, help me with this one. What is the difference between processed meat and clean-cut meat, which is the term I'm going to use, other than quality? What happens to processed meat that makes it dangerous?
So there are a couple of things in processed meat that make it additionally dangerous. So what we know that is associated with negative health impacts is heme iron. That is in both red and processed meat. But in processed meat, there are also nitrates, nitrates, and plenty of sodium, which are implicated to be associated with the extra burden, so to say.
So it's what they add to it, it's not the meat itself?
Well, as I said, the heme iron is in the meat itself, so that is...
But that's in the other meat as well, isn't it? I'm talking about processed meat particularly.
Exactly.
Okay.
Yeah, and there are experiments going on where people use less nitrates, so that would indeed be a bit healthier.
How come a tax is going to help then? Just is it going to stop people eating this sort of stuff?
Well, you always need to think why you want to introduce a tax, right? I mean, if it's declared carcinogen, I think then governments have a responsibility to really regulate because you expose your citizens to a carcinogen, right? A tax, exactly. And a tax is the least intrusive way of regulating a carcinogen, right? You don't ban it, you still give people the choice. But it basically serves two purposes. For one, you discourage consumption, and for the other, you raise the costs that you need to pay for those health costs. So it's basically an argument of what is a fair price, right? You can still eat.
Well, we could get into this
but...
argument about covering the costs of healthcare when it comes to cigarette tax, and know that the British National Health Service would fall apart probably if it didn't get tax from smokers. And that's not going to happen with meat eaters, is it?
Well, I mean, that is the proposal, so to say. I mean, we don't, in the tax rates we calculate, we don't cover the cost completely. That is just due to the sort of optimal taxation theory we are following. If we were to do that, then taxes would even need to be 200% on processed meat to cover the full costs. But we think at least making a start on it,
Bill, yeah. We're going to go to Bill because he's shaking his head, and I'm also going to throw this one at you, Bill. Okay, so Marco's pro-tax. I think you're anti-tax. But let me throw this one out there. Alcohol, people drink alcohol, it causes fights, yeah? There's a damage there. They drive cars, they crash cars. People who smoke cigarettes, well, a lot of people think it's antisocial. Yeah, the smell's unpleasant. When it comes to red meat, you don't get car crashes, you don't get fights caused by eating a steak, you don't get the filthy smells that you get with cigarettes. So what is the real reason you think people perhaps want to put a tax on red meat?
Well, if you allow the play on words, this is really salami tactic. The salami tactic here is we ban one thing or we restrict one thing after the other until nobody can have fun anymore. And what is interesting is Mr. Springmann said a few things, but he didn't say what he said 2 years ago. 2 years ago, he was arguing for 40% tax on beef, and he also wanted to tax chicken and eggs. And now he's not bringing that up anymore, so that's quite interesting. 2 years ago, he also wrote an article for The Conversation, then republished for The Independent, in which he said we should basically go vegetarian. So that is the end goal. As soon as we accept this, they're gonna, and everybody eats then red meat only once a week, they're gonna say, oh, well, actually, we want people to become vegetarian completely. And that should be then the next goal. So it never ends. And they don't have the intellectual honesty of actually telling us where they want to end up. What is the end goal? Where do you want to end? Because this is just one tax leading up to another one. Because what has been said before, I could do the exact same thing when it comes to coffee. Coffee has one cup of coffee has 1,000 chemicals in it. It is just more dangerous than caffeine. It is just as addictive as nicotine, sorry, and it's just as addictive as nicotine. It can lead to cancer. It can lead to hypertension, to kidney problems and depression. And just claiming something is linked to cancer doesn't give people any idea as to what the degree is. Not all of these products have the same degree of risk, and pretending that it is intellectually dishonest.
Sophia, I don't know whether you want to respond to anything he said, but my question to you is going to be, there are an awful lot more other things besides red meat that are carcinogens. Why are we worried about this one?
Well, I'd actually just come back and say that the best evidence is not that coffee causes cancer. There's some studies which show that it reduces the risk of things like liver cancer if you drink lots of it. And so that is something that we would not be calling for to cut your coffee consumption. What we do call for is for people to focus on the things which have the biggest impact on their cancer risk. And that's things like stopping smoking. Stopping smoking is the best thing you can do for your health. And that's
come down from the top. Stopping smoking. Next.
And then keeping a healthy weight. So that's why things like the sugar tax are really important on soft drinks, because they have no nutritional value.
Keep on working down. When do we come to red meat? When do we come to red meat? What's after sugar?
UV, so overexposure to...
so it's a long, long list. And is red meat down the bottom?
It's around the middle, but it's kind of combining those measures of a healthy diet. So things like fibre are also really important.
So people like Marco are just sort of banging the drum and hoping that people will hear him banging this drum and jump on the bandwagon.
Well, it's important to raise awareness because only 4% of people know that processed meat causes cancer. So studies like this are really important to raise awareness. But for Cancer Research UK, our policies are focused on bringing down obesity, which we know is the second biggest cause of cancer. And that's what we're calling for rather than a tax on processed meat.
OK, we're going to talk about whether it's worth living in a hermetically sealed bubble where you don't have any alcohol, cigarettes, red wine, red meat, etc., etc., etc. You might live to be 150, but you'd think, well, what was the point? But do you wanted to say something, Kirsten?
You know what? I just don't think that... I think that too much red meat can be dangerous, but I think red meat has so many health benefits. Do you know, I guess people do come to see me when they are ill, and the amount of vegans and vegetarians that come to see me with B12 deficiencies, needing iron supplements, because they've removed this because they've had a scaremonger, they've read a headline, red meat causes cancer, they stop eating it, they switch to a different diet, but they don't replace the nutrients that they're missing out on.
OK, well, if I wanted more B12, I could eat spinach, right?
Not entirely, because...
Well, no, nothing. I don't want to entirely eat spinach, but I mean, that
No, B12 is predominantly found in animal products. We manufacture B12 from our gut bacteria as well, and most of the B12... If you are a vegetarian or a vegan, even the Vegetarian and Vegan Society advise you to supplement with B12.
So you can't go out and eat other B12. You only find it in red meat?
You only find it in red meat. You can find it in some sea vegetables, milk and animal derivatives.
I could have sworn it was printed on the side of my packet of Rice Krispies when I was growing up.
It's supplemented, isn't it? It's
okay.
not naturally
so they've added it.
Yes, you can get it in fortified cereals.
Marco, you're scaremongering.
No, B12 you can get in other animal products as well, even in insects, by the way. But I briefly want to come back on the things that were said. Indeed, we also published a study looking at the climate damage costs that are associated with the greenhouse gas emissions that our foods emit. And that is indeed a very important other avenue that you might think of. I mean, the real question is, what is the real price of food, right? If there are things in our foods or in the production of our foods that are not accounted for in the price, then it makes sense looking at what that price would be, right? And if we don't pay for the climate damages that our foods cause, then there is also an argument for looking into that, as it is for the negative health impacts.
Just interrupt, Kirsten, that's what I do.
Are you just trying to basically price people out of consuming meat? Because that's how I see it. You're just trying to scaremonger people so they stop eating meat. So everyone is in an ideal world, would everyone be vegetarian or vegan for you?
I'm not scaremongering here. I'm looking at the evidence. This is all sort of accepted dose-response relationships.
Do you just want everyone to be vegetarian or vegan, though? Is that your ultimate goal? Is that what you want? Do you see...
I don't have a personal goal here of how I want to make people eat. You know,
Okay.
people decide themselves how they eat.
Okay, let me ask you this. Let me ask you this.
Health,
So if
public
people
health-
can
Allow
decide
me,
how
Marco.
they-
Allow me, Marco. What do you think of meat eaters?
I don't have what position should I have on meat eaters. If people want to eat meat, they can eat meat. So the problem is, if public health professionals have looked for a long time to make people eat healthier, and part of it is exercise, as was said. A part of it is giving up smoking, and part of it is having a healthy diet. And overeating red and processed meat is surely part of an unhealthy diet.
Bill, I'll come to you in a minute, but I want to ask Sophia about health
unhealthy.
benefits here.
Red meat.
Let's go back to this
Sorry.
idea of
Yes,
everything we do is designed to make us live longer, live healthier lives, but ultimately more boring, dull lives.
Well, we're not saying that you can never have a steak or a bacon sandwich ever again. It's just if you're eating a lot of processed and red meat, that's when you should be thinking about cutting down. The government recommends you eat 70 grams of red or processed meat a day. That's equivalent to about 2 sausages or 3 slices of bacon.
They recommend we should eat that much a day.
So that's the kind of maximum limit that you might want to
that's quite a lot,
consider.
isn't it?
Exactly. So we're not saying that you never need to eat a steak ever again. It's just about cutting down where you can if you're eating a lot, because that's where the increased risk of things like cancer and heart disease come from.
What other studies are you looking at that back up these claims?
So we recently did a study this year which quantified the number of preventable cancer cases in the UK across a whole load of different risk factors which were classified as definite causes of cancer by the International Agency for Research on Cancer. Processed meat was one of these risk factors, and we found that by combining information on how much meat people eat, how big the increased risk is, and what cancer types it's linked to, you could prevent 5,400 cases of bowel cancer a year in the UK.
And it is principally bowel cancer here we're talking
yeah,
about?
we're principally talking about bowel cancer. There is some evidence of increased risk for other types of cancer, but in terms of the strongest evidence, yeah, we're talking about bowel cancer.
Bill, jump in.
Yes, well, actually, if you look at the numbers of Cancer Research UK itself, and if you go on the website, and I encourage people to do so, she didn't answer the question before. It actually is quite down the line when you look at meat, and she didn't want to mention it. It is even according to Cancer Research UK itself, eating meat is one of the very low exposure risks when it comes to cancer. But I also want to jump in to answer the question that Mr. Springmann was asked, and of course the answer is yes. Of course, he'd prefer everyone to become a vegetarian. That's exactly what he writes in his article.
That's what exactly, I want to do.
Well, you write it yourself, and people can read it for themselves. I want to just I want to finish my sentence. So when it comes to unintended consequences. Unintended consequences are very important, because that's also what Mr. Springmann doesn't look at. He assumes that if you increase the tax, some people will actually reduce their consumption, although he doesn't provide price elasticity for that claim. But what I want to say is that we've tried this before. Denmark tried this in 2011 with a tax on saturated fat of more than 2.3%. And what we saw is that the same parliamentary majority that introduced it abolished the tax 15 months later because it did not work. It didn't work because no, I know exactly what you're going to say, because the claim is that it was reduced by 10 to 15%, but it wasn't. The actual reduction was 0.9% because people stockpiled by going to Germany and stockpiled for months before the tax was introduced, and so the actual reduction was 0.9%.
Are you serious? Somebody would cross a border to drive into another country to save 10% off a can of corned beef?
Yes, the evidence actually shows that, and the consumer behavior shows that. And lastly, what I also want to say is what people did is they downgraded in quality. So people kept their fat consumption, but downgraded on the price. So they bought the cheaper brands in order to keep the same consumption. So just assuming that if people get rid of red meat multiple times a week, they will just stop their consumption of the same nutrients altogether. That's not true. We all know this. We come home from a trip, there's nothing in the fridge, we take the first thing we find. We eat candy if we don't have meat there. So just assuming that people give up meat and then don't use something else, it's just ignorant.
But if you eat one second, Marco, if I would, if you eat 14 sausages a week, or the equivalent of, which is what Sophia is saying, the government advice is no more than 2 sausages a day, well, you're asking for trouble anyway, aren't you?
I agree. I think, this is all about education. It's all about our personal responsibility to choose. We have to know the risks. We have to weigh up. And I don't think adding a tax is going to prevent someone from buying it. I mean, this is aimed at higher and middle class earners.
Yeah.
So you're effectively abolishing lower classes and low income families consuming it anyway. Is it really going to affect them if they're earning? Are they going to stop buying it? No, they're probably not. No, not. So there's different ways to do this.
Yeah. If there's a tax, and I'm not sure whether you are in favour of it or not at the moment, but if there is a tax, and people have been talking about it for some time, what kind of ring fencing would you like to see around it to make sure that it is put into health rather than perhaps fixing the potholes outside my house on the road?
Well, I think if it's a tax for health benefits, but as Marco has said, there's also environmental consequences of eating too much red or processed meat. So I think it would have to be...
Among other things, if we had fewer cows, fewer lambs, we would have less methane, we would have less damage, among other things, to the air which we breathe.
Yes.
So why don't we, instead of taxing meat, why don't we work with farmers to have a more environmental way of farming? Why don't we look at why are we always going to the end result instead of working backwards? We need to start from the basics. We need to work with farmers. We need to work with supermarkets. We need to work with the supply and demand instead of just putting a tax on it at the end.
And I interrupted you. I'm terribly sorry about that, but carry on and finish your point.
Well,
but then we'll go to Marco.
I was just going to say that it's about, well, that's kind of partly what we're calling for. We're not saying to eliminate all meat, we're saying to cut back, and it can form part of, eating meat can form part of a healthy diet, and the kind of policies that we focus on and the taxes that we focused on, we campaigned successfully for the introduction of the sugar tax, and we now want to see restrictions on junk food marketing, specifically because that junk food has little nutritional value, and it does often have an overlap with processed meat, but that's what our focus is rather than a tax on processed meat.
Marco, we stopped you saying something a little bit earlier.
Yeah, I mean, I wanted to briefly come back to this Danish saturated fat tax. I think it's a very interesting case study, in fact. I mean, it's clear that many things didn't work well there, right? So I wouldn't hold that up as the example of how it should be done. But it really shows you that if you introduce a tax and you have not so much, you don't provide enough information for people to understand why there is a tax, and you use the tax revenues for something people don't see. So they gave them, I think, breaks in income taxes. Then it doesn't work so well. Whereas when we look at, for example, the sugary drinks tax in Mexico, they used the tax revenues for installing clean water fountains, and they had a very good public information campaign. So that apparently worked very well. And in the case of red and processed meat, I mean, you can think about that. Indeed, low-income households might be hit most for this tax. So you need to provide information of how they can access cheaper alternatives, what would be healthier for them, and to offer support. So a tax is really one instrument that sends a signal throughout the market, but it needs to be accompanied by other instruments. And from the behavioral change literature, we know that just talking about it and providing information really doesn't work. So you really need a little bit of a stronger measure in concert with others.
Yeah. But Bill, is a tax coming?
Is a tax coming? Well, that's going to be seen, because public health advocates keep adding more ideas for new taxes all the time. We have about like 3 a week now. No, what I really want to say is what I find interesting. We have this panel, and I'll just go on an assumption here. I believe that none of the people on this panel actually could be considered as low income, and I find it quite arrogant. What we do is that we talk about people who are on lower incomes, and we say, well, I mean, those people, I mean, we don't care if they can't afford it anymore, because this is a quasi-prohibition. This means that some people will not be able to afford this meat anymore. And we just don't care because, well, maybe we're an Oxford researcher and we actually live on a good income. So we're not really affected by this tax.
Marco, we're going to have to sort of draw a line under that side of things because we're coming towards the end of the programme. Who has any right to tell me or anybody else what I should and shouldn't eat?
If you are ill and you want to improve your health, if you go to someone for professional advice to ask them how a change in your diet can affect the quality of your life and your health.
But I'm asking then, it's not being forced upon me.
I think that is the only place. I mean, we all need to be educated. We all need to understand the
Yeah,
implications
and then
of
you've got
what
a
we're
choice.
eating, and then we get to choose. In California, they have labels. Outside McDonald's, there's a big sign saying, food, blah, blah,
If you
blah.
value your life, don't stop here.
Is carcinogenic. Why don't we do that?
So Sophia, should somebody have the right to tell me what I eat, even if it's going to kill me if I do eat it?
Well, I think you're only looking at it from one perspective, thinking that everyone's telling you to eat healthily. But if you actually look at adverts, which you're bombarded with every day, they're telling you to eat fried chicken, eat hamburgers, and yet we're not tackling those aspects as well. So you need to make the healthy choice the easier choice, not restrict people, but just give them the option and the information they need to make an informed choice about their diet and their own health.
Okay, I'm going to make a little guess here. Marco, it's coming up to, what, 7 a.m. in Washington, D.C. Chances are you haven't had breakfast yet. My guess is that you're not going to head off to the buffet at the hotel or the bed and breakfast you're staying in and have bacon. Am I right?
That is right.
Bill, thank you too for joining us from Brussels. Whatever you're going to eat today, whether you're in Europe, the United States, or here in the United Kingdom, where it's pretty much coming up to lunchtime as we sit here, good luck with whatever you eat, because you could be pretty scared with everything that you've been hearing these days. Listen, from me, from my guests, from the team that put this roundtable together, thank you very much for watching. Goodbye for now.